One of the biggest disasters in orthopedic history has occurred due to a recall of more than 93,000 of DePuy's articular surface replacement hip implants. The ASR is a metal-on-metal hip implant that has been reported to generate metal debris, causing pain and disability in patients. This implant failure is due to metal corrosion.
Corrosion is the deterioration of a metal through oxidation, and we can see it everywhere in our daily lives. The tarnish on old pennies, the rust on iron chains, the chemical reactions which occur in batteries, these are all examples of corrosion. Corrosion in metal implants leads to brittleness and leached foreign particles that can cause inflammation and pain in patients. Our team's goal is to determine if the length of the neck of the implant will have a positive correlation with the level of corrosion.
Metal corrosion typically occurs between the junction of the neck and the femoral head of the hip implants. Measuring the corrosion on the neck component is fairly easy, but within the femoral head it can be more difficult. Reverse cast molds are used to overcome this complication. This process allows us to create molds that can be later analyzed using interferometry, a technique that analyzes roughness to measure small impurities and crevices. A PVS gun is used to inject PVS, a molding material, into the femoral head component. It is allowed to dry and is then removed. The result is a mold with detailed indentations of the corrosion.
In the future, we will be using the interferometer to quantify the amount of corrosion in the head component. We will then assess the head and neck levels of corrosion and compare them to the length of the neck components to see if there are any trends. Contributing to hip corrosion research will ensure that surgeons can make an informed decision when it comes to choosing the right implant for their patient, leading to an improved patient experience and a longer implant lifespan.